Fernandez. I'm a 5 college postdoc in comparative reproductive politics. I'm teaching currently at UMass, and I do work on the politics of abortion, in particular in the southern cones, so Argentina, Chile, and Uruguay. We have like a great panel with 2 international speakers, and also like a professor here from Hampshire. I'm going to introduce them as we go. As they start their presentations. So welcome to the panel. El acceso al aborto legal, seguro y gratuito es un derecho humano. Safe and legal access to abortion is a human right. We're going to explore different experiences from Latin America. And let me start with my presentation. Then I'm going to do 2 things in my presentation. Just first give you like an overview of the status of abortion in Latin America, so we can have some context to the cases that we're going to be talking about. And then, as much as time allows, I'm going to go a little bit into the case of Chile, just to let you know what is going on at this particular time in Chile and the case of abortion. So just to get, is this good, or should we turn off some lights? Can you? Okay. So just to have some overview, in Latin America, according to the Guttmacher Institute, there are 4.4 million abortions annually, 95% of which are unsafe, and they're actually responsible for 12% of maternal mortality. To give a legal perspective, this is a region with a highly restrictive legislation on abortion. Abortion is actually only allowed based on the decision of the woman during the first trimester in Cuba, Uruguay, and in Mexico City. So those are the only 3 places. In most of the countries, abortion is criminalized. We have like 5 of the 7 cases in the region in which abortion is banned under all circumstances. Those are Chile, Nicaragua, El Salvador, Honduras, and Dominican Republic. And in Dominican Republic, I should clarify. 1 less, 4 of the 6. I'm sorry. And in the rest of the country, legislation criminalizes abortion under most circumstances, with some exceptions, which they're not always like easily available. So also access to these particular exceptions is a problem. The most common are those of therapeutic abortion, so when the woman's life is at risk. Some also include the women's health, although sometimes the legislation is ambiguous and it can be enforced like in a very liberal and like broad interpretation, or in a very restrictive, like a particular illnesses that are considered a requirement to have a legal abortion. Cases of rape, incest, or fetal malformation are some other exceptions present in the region. What is the impact of this very strict legislation on women's health? Well, very few people are actually prosecuted and actually convicted. With the exception of the case of El Salvador, there has been like an international crisis, if you've heard, of many women that are actually sentenced to like 50 years, even for having miscarriages that are suspected of being an abortion. This is the case of Las 17 or the 17, that is a group of women in which, around which there's an international campaign to ask for their release. So this is something particular that if you're interested, you can search and try to support this international campaign. But in general, these laws are not enforced. However, they really impose like a lot of hardship on women. Unsafe abortions are usually, as I mentioned, one of the main causes of maternal mortality. There's a high level of morbidity, many illnesses and health problems due to unsafe abortions. There's also mistreatment, and stigma, mistreatment at public hospitals. When a woman comes with an incomplete abortion, they are they receive medical attention last, or they are insulted. They receive attention without anesthesia, so a lot of punishment, for what they have done or presumably done. There is a perpetuation of social stigma because of these laws that criminalize the practice. And what is worse is, as usually, the women that suffer the most are the poor women. Because if you do have some money, paying, you can actually have access to an illegal but safe, medically safe abortion. But this is not the case for many women in Latin America. What is happening, to react to this situation? Well, since 1999, there has been a regional campaign, the September 28th campaign, that is created by women's organizations to push for the decriminalization of abortion. And their main slogan is sexual education to decide, contraceptives so as not to have an abortion, safe abortion so as not to die. And they have been having branches and organizations all throughout the hemisphere. And actually, the campaigns that were successful in Mexico City and Uruguay, can be traced as, part of the successes of this regional campaign. However, there's a second trend one towards criminalization, because of the countries that we mentioned that have a total ban, that was not the case until the 1990s or year 2000. They moved from a legislation that allowed therapeutic abortion into one that criminalized even that situation. And this is also clear in Mexico. Once Mexico City passed legislation, legalizing abortion during the first trimester, many of the other Mexican states, had like a backlash of like passing legislation that was more restrictive. So we do have this competing trends within Latin America. And one of the reasons is that since the 1980s, the Catholic Church has set, like Latin America as their target for their policies to prevent any change in abortion laws. In a way, once the Catholic Church and the Vatican lost the Catholic European countries, the Catholic developed countries that passed, legislations that legalized abortion, they kind of started shifting their target and their focus on Latin America, in particular with Pope John Paul II during the 1980s, and then Benedict, he was not there for a long time. Sometimes, I get asked a lot about, well, so what is going on now with Pope Francis, which is actually the first Latin American Pope, that he's been already in his position for 2 years. And, things are complicated. Like, in a way, it's true that he's moving the emphasis away from what the church considers like moral issues, that those are not so prevalent in his speeches or in his policies or his agenda, towards more socio-economic issues. So in that way, it is a breath of fresh air, within the Catholic Church. There's also an expectation that this is a reformist pope, that he's going to bring change within the Catholic Church. However, the same fact that he's seen as a reformist pope is like bringing kind of like a renewal of religiosity in some of these Latin American societies, that can be also a threat towards any change in terms of reproductive rights, and in particular with some politicians. And I come from Argentina, and in Argentina, since the Pope comes from, was a previous Cardinal of Buenos Aires, it's very interesting how many politicians that used to be like in very strong opposition to the Catholic Church, and in particular to his figure, once he was appointed Pope, they really see it as politically costly to like push for anything that will oppose the Pope, and they keep on visiting and like having this very close relationship with the Vatican that was not there before. So for example, in the case of Argentina, I see this as like closing opportunities for any legal change in the issue of abortion. Let's talk very briefly about Chile, and I don't know how much time do I have. 3 minutes? Oh gosh, okay. So just to let you know what is going on in Chile, Chile is one of the countries which had a therapeutic abortion since the 1930s, but in 1989, the dictatorship of Pinochet, as one of his last acts of government, he banned the therapeutic abortion regulation, and since then they've had like a total ban on abortion ever since. So very quickly, because I don't have time to go into what explains this, definitely there has been like a weak social movement. The women's organizations have been strong in Chile, but not surrounding the issue of abortion. There have been a lot of division, and it's only recently, I would say in the last 2-3 years, that we see more demonstrations and people in the streets, actually like thousands of people demanding for a change of the legal abortion. But like for most of since the democratic transition in '89 until very recently, the campaign for legal reform of abortion has been like very weak. This comes together with a strong Catholic Church, which I'm not going to go into detail now because I don't have time, but they do have like links with the two coalitions, the right-wing coalition and the left-wing coalition in power. For some reason or the other, they have strong links with them. So whoever is in power, still like is pretty much like close to the Catholic Church, together with a strong presence through the educational system. Like the Catholic universities and schools are very prestigious, very strong academically, and a good image among society because of the role the Catholic Church had during the dictatorship of having supported the human rights movement and opposing the Pinochet dictatorship. So it has quite a bit of legitimacy within society. So that makes it hard. The other thing is like the extremely conservative Senate that Chile had during all these years due to also specific political electoral system that they had, and the presence of some non-elected senators that have been appointed by Pinochet in the beginning of the transition that made the Senate be like much more to the right than the actual electorate was. But however, things are changing. From civil society. 1 minute. Okay, we have two things happening. One is the lesbians and feminist for the right to information have launched a safe abortion hotline, you know, that's through which they give information on how to have a medical abortion. They can't recommend or anything because what to do or listen to personal stories, but they can say, according to the World Health Organization, you have to do this, 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 and that is, you know, legal because it's the right of information. But they have to be very careful with what they say, or they can be sued, and there have been cases. And second, this movement Miles, which in Spanish translates to English, thousands for the legal interruption of pregnancy. So Miles por la interrupción legal del embarazo. And which has launched, since 2010, a campaign to legalize abortion only in three cases, just like reinstate therapeutic abortion that was there. So it's a moderate change, but it's something from going to the ban. And this has been supported by a change within the executive branch. The current president, Michelle Bachelet, which is in her second term as a president, had decided that reinstating therapeutic abortion is a priority for her government, and she has presented and introduced a bill in Congress which is currently being discussed. And I leave it there. If you have more questions about Chile or anything, you can ask me later. Thank you very much.
Wow.
So I'm going to introduce Roosbelinda Cárdenas. She's a cultural anthropologist whose work focuses on social movements in Latin America and follows an engaged methodology which straddles activism and critical analysis. In addition to teaching at Hampshire College, she's also a researcher with IPPFF WHR, where she collaborates in research on abortion and gender-based violence in Latin America.
I think I'll tell you ahead of time that I'm probably going to fly through the research results. I'm presenting on the fresh and still ongoing preliminary research results of an ongoing research project that I've been a part of. And I just wanted to tell you a little bit of the context in which the research is being done. So I'm a researcher for International Planned Parenthood Federation, the regional office for Latin America, which is a particular model of working with local organizations in Latin America. So there's no Planned Parenthood clinics or offices in Latin America. What they do is they affiliate and create partnerships with local, mostly service providers in Latin America. So as Cora mentioned, and this was great that we now have
so you can
I can jump right into the research. One of the very prevalent barriers to access to legal and safe abortion that IPPF and I think in general feminist organizations have identified in Latin America is stigma. So the focus of this research project was identifying stigma in clinical settings. Specifically, what we did was a mixed methods research project, both with providers and users, and in some cases, like in the case of the Dominican Republic, with peer use educators, because they have groups of young people that serve as advocates, local community advocates. The project itself took place in 4 countries, but I'm only going to be speaking about 2. So we also did research in Argentina, and since we have presenters that are going to be speaking about Argentina, I'll refrain from speaking about that, and on Colombia. One of the things that I think was fascinating about this research project was that we worked with countries that were pretty much all along the legal spectrum, from the most liberal legal contexts such as Uruguay to the Dominican Republic, which just until last month was one of the absolute banned countries, and now they've moved to the 3 exceptions: fetal malformation, incest, and rape. And so what I'm presenting for you today is in fact the 2 ends of this spectrum, the 2 poles of the spectrum, which we had for this project, which was the Dominican Republic and Uruguay. I should also probably say, I'm going to fly through, but in very briefly, there are research questions where we wanted to know how abortion stigma is experienced by women and by providers, right? Because medical providers also experience stigma as providers of abortion services in various countries in Latin America. And we also had a hypothesis that as providers became more active in their provision of abortion services, we might see a reduction in stigma. So maybe as it becomes more normalized and as maybe they speak about it more openly, that maybe we would see a reduction in stigma. I have here a little bit of the theoretical framework on how we're thinking about stigma, but I'm going to fly through that as well. But just very briefly, we wanted to see stigma in sort of 3 types of stigma: experienced, perceived, and internalized. And also at various levels, how it operates at various levels, from the individual to the institutional to the community level, and how it manifests in different settings, although we were primarily working in clinical settings. one of the things that I should probably clarify about the service itself that we were observing is that in the DR, because of the legal setting, the type of service that was being offered, I don't know if it's the same as you were mentioning for Chile, but we call it harm reduction, which was inspired actually, which was modeled after a type of service that was begun in Uruguay with a local organization in Uruguay called Untitled. And they themselves abide by the principles of harm reduction and also drug use. But what they do is they protect themselves with international legislation about the dissemination of information on the use of a medication for abortions. So it's an incredibly, up until a few weeks ago, an incredibly restrictive legal setting, and so the service was limited to providing women with information on how to safely use misoprostol. And whereas in Uruguay, even though the majority of the abortions that the clinical setting that we worked with was with the same organization that developed the harm reduction model. But although the majority of the abortions that they were performing were also medical abortions, non-surgical, but through misoprostol and mifepristol. I don't know that one.
I don't know how to pronounce it. Mifepristol?
Yeah, mifepristol.
Okay. Although the majority of the abortions are also medical, they're no longer following a harm reduction model, but it's an open legal setting. And they don't, women don't have type exceptions. They have to go through a particular process, which actually does involve, I think, it's not entirely perfect and uncontroversial. It does involve that the women have to go and before they have to go, they have to see what is called an interdisciplinary committee, which includes mental health and health professionals, and they have to go through a 5-day waiting period, after which then they can have access to the abortion. Okay, so the projects were very different in terms of, well, these two projects were quite similar in terms of the general methods that we used. Like I said, we used mixed methods, and so we did surveys and in-depth interviews with both providers and users. Because of the difference in the legal context, our sample sizes and the characteristics of our samples ended up being incredibly different. It was very difficult to speak to women in the Dominican Republic, given how restrictive the legal setting is. And even, first of all, personally, I thought it was mind-blowing the volume of women that were seeking abortion services. And we were just wondering, where are women finding access to safe abortion, not legal in the Dominican case, but they were not coming to the clinic, or mostly they were coming to the clinic with incomplete abortions. And one of the really, I think, big challenges in the Dominican Republic was how to advertise, right, for this kind of service, such as a harm reduction service, which is legal, but at the same time, people were both providers and women were very wary. So some key findings. So also just to give you a sense of the kinds of questions that we asked. For providers, we asked them questions that, that had to do with their attitudes and perceptions on abortion, on motherhood. And also, we asked them questions about their experience in the service, going back to what you were saying, so about their experience stigma, right? Whether they felt mistreated at any point, whether they were mishandled, whether they were given information that they did not want to hear, whether they were not given information that they were entitled to. And also what their perception of community views regarding abortion were. With providers, we also asked them questions about their general views on abortion. But we also asked them, and also for both sets of respondents, we asked them questions about disclosure. How often they talk about, in the case of providers, how often they talk about the work, and specifically the work in abortion provision, with their colleagues who don't provide abortion services, how often they talk about it with their family, with their peers, and also whether they have experienced stigma as being abortion providers in the clinical settings from the rest of the staff, both medical and non-medical staff. So these are the kinds of questions that we asked. So they have to do, disclosure was very important, and the experience with the service provision was very important, as well as their perceptions and opinions on the law. I'm going to fly through the actual, I'm getting dissonance. Sí, no, this is how much, eso es lo que ya hablaba.
I said 30 minutes, 5 minutes left.
So I'm still going to rush through the actual results. There's a lot of numbers. We have an immense amount of data that we're just starting to chew on. And if you're interested in hearing, in more detail the results, we can go back to them, and I'll probably just go to the conclusions. But so we asked questions like, how significant is a problem with complications associated with unsafe abortion? And I think one of the things that you can see in this result is that the difference that I think is obviously has a lot to do with the legal context, right? The perception that it is not so much of a problem in the Dominican Republic. We asked them about their opinions on the law. We also were really interested in speaking to medical providers that were both currently providing abortion services and those who were not. In the case of Uruguay, it ended up, it started out as a proxy for conscientious objectors, but it ended up being pretty much aligned that all of the non-abortion, all of the, in this case, gynecologists that we spoke to that were not providing abortion were objectors. And so we were interested in looking at the differences between those two. We were also interested in asking people what their opinion and their knowledge of the law is, because I think a lot of what, of the way that stigma functions is through disinformation, right, or silence, both silence and disinformation. So we asked them about disclosure practices. Do they think, who do they tell, who do they talk to, but also do they think that women should maintain their abortions a secret? One of the other key things that we were interested in, given that in Planned Parenthood Federation we work specifically with abortion service providers, but this is a service organization, we were interested in finding where along in the steps that a woman goes through in the process of getting an abortion, where they experience the most stigma. And so one of the things that we found pretty much across the board in the four countries had to do with specific staff members and specific moments, like ultrasound is a key moment in which if you don't have people that have a clear political perspective on women's right to abortion, to safe abortion, then this was a point where women reported having experienced stigma. Because this was a mixed method study, we did something that I think it is actually being done for the first time in Latin America. We took some stigma scales that had been designed for the US, and we went through an incredibly grueling process of trying to adapt them to Latin America. Now, let me just tell you, I'm an anthropologist, so this was this was very difficult. We took the scales and we compared them both for providers and both for users, women clients. And just very briefly, one of the things that we found that I thought was interesting was that in general, well, so this is a comparison with the U.S. The stigma among women was higher in Latin America, and there were subscales, so there were categories: worries about judgment and their own self-judgment, right? So judgments of themselves. And the scale goes from 1 to 5, just to give you a sense. Well, I didn't talk about Colombia, but we also have numbers for Colombia. These are some of the kinds of questions that we ask providers. This is part of the stigma scale for providers. I'm not going to pause very long on that. But one of the interesting things that we found with providers is that contrary than women, providers in Latin America seem to report, at least, lower levels of experienced stigma. And we think that's associated with that they have found some interesting mechanisms, coping mechanisms, solidarity, and have also sort of seemed to shift the interpretation of being stained towards being a particularly political identity. We're committed to this. So this is some of the initial findings, and I will wrap up with these conclusions. Oh, I made it to the conclusions. So, yes, despite some of the data collection challenges, we believe that these findings will provide some foundation for a conversation on how to continue to improve the experience of women, particularly as they go through the clinic. We also have seen, because we took data at a baseline and an end line, and we believe that the data already tell us that interventions with providers do seem to have a positive effect on stigma. Like I just mentioned, the data suggests that providers in Latin America have less stigma. I don't know if the comparison with the US matters, but that they have built, and it's important to continue to support those mechanisms that they have constructed in order for resilience and for coping. Okay. I'll just stop there. We still have upcoming work and some of the data still being processed, but I think I'll close with this. One of the really interesting things about this project for me is that because this is done and with an organization whose work is focused on access and on advocacy, the research results will be immediately taken back to these settings, the clinical settings. And so that's very exciting to see research have consequences. Thank you.
Thanks. So we'll switch the computer again. Hopefully a smooth transition. And next we'll have it's so smooth. Is it up there?
Es que creo que en este momento es el primero de trabajo con la nota 3.
No aparece nada.
Es que creo que es un poquito chistoso.
Okay.
Tienes que conectar este primero antes de meterlo.
So while you do that, I can introduce Ruth Zurbriggen. She is a queer activist, researcher, lecturer, and gender studies specialist. She is part of the feminist collective La Revuelta in Neuquén, Patagonia, in Argentina, and the Socorristas en Red de Argentina, that is the network of abortion clinics. As a member of the Socorrista network, Ruth accompanies women seeking medical abortions. Her primary areas of investigations are bodies, sexualities, pedagogies, abortion access, activisms, and social movements.
Se me hace difícil, buenas tardes, hablar en español y que sé que poca gente a lo mejor me está entendiendo con todo lo que quiero decir. Trataré de hablar lenta para que ella pueda traducir las notas que preparamos. Bueno, me parece primero que el título del panel que nos planteó Cora, el derecho al aborto legal, seguro y gratuito es un derecho humano, es toda una definición política. Creo que tiene que ver con que pensemos que ese derecho humano nos es negado en un sistema, me importa como contextualizar cómo estamos pensando esto, nos es negado a las mujeres en un sistema capitalista, colonialista, heterosexista, racista. Y para terminar con este pedacito y que ella pueda traducir, sí quiero decir que me parece coincidimos nosotras desde la revuelta y las socorristas en que el cuerpo de las mujeres es la última frontera del capitalismo que necesita ser controlado política y económicamente.
She said it may be difficult to express everything since maybe premature may not understand Spanish, so I'll be doing a translation for her. And she just said, regarding the title of this panel, contains a political definition to recognize the right to have an abortion as a principal human right that is denied to us by a heteropatriarchal, colonial, sexist, racist, and capitalist system in which we live in. The body of a woman is the final border of capitalism, and to control over women's bodies is an economic and political matter.
Bien, pensamos también que para desplegar ese control los estados y los gobiernos criminalizan, han criminalizado y siguen criminalizando la práctica, por lo menos en América Latina y el Caribe, como recién explicaban las compañeras, y en muchos países del mundo, ¿no? Y que pese a esa criminalización, a lo largo de la historia de la humanidad, las mujeres hemos abortado y vamos a seguir abortando.
And to spread that control in many other areas, the states and their governments criminalize and continue to criminalize abortion practices. However, throughout the history of humanity, women have aborted and will continue to do so, and we will continue.
Por eso pensamos que cuando las mujeres decidimos abortar, tomamos por asalto nuestra autonomía corporal y desdecimos justamente las leyes criminalizadoras y penalizadoras. Las socorristas nos articulamos para pasar información y acompañar a mujeres que deciden abortar, para que lo hagan de manera segura y para que atraviesen esa decisión de forma acompañada y cuidada.
So we are convinced that we women who decide to abort take hold of our bodily autonomy and we go against, and we say this with determination, the text of laws that criminalize and penalize. We, the Socorristas feminist activists, organize in order to share information and the women who decide to abort, so that they do it in a safe manner to go about this decision with support and with a group of supporters.
Bueno, por eso Socorristas en Red, pensamos nosotras, implica una relación particular con las prácticas de abortar. Y nos llamamos Socorro Rosa en clave, como decimos nosotras, en clave genealógica, ¿no? Hubo experiencias similares en la década del 70 en Italia, Francia, en Estados Unidos. Entonces, de allí como que nos sentimos identificadas con esas experiencias.
So, the network of Socorristas works in a mode of relation particular to abortion practices. It contributes to stretching the limitations and means of this practice amongst feminists, health personnel, and various sectors in society. And we created the Socorro Rosas. We take this name in a genealogical code, unavoidably inspired by the efforts of the feminists in the 60s and 70s, in particular that of the Italian ones, but also the French and American ones, who generated spaces of confinement for women who needed an abortion in a clandestine context.
Estamos en 22 ciudades de Argentina. Empezamos a conformar la red por iniciativa de la colectiva feminista La Revuelta, que vivimos en el sur del país, en la Patagonia, en el año 2012. Y hoy, en ese momento éramos 4 colectivas y ahora somos 22 colectivas que estamos distribuidas a lo largo del país.
So we are active in distinct parts of Argentina, and to date there are collectives of Socorristas in 22 cities. We launched in 2012 with only 4 collectives, and the largest increment in collectives took place in 2013 and 2014.
Acá está traducido, así que si querés, hasta el control médico, a toda esa parte la podemos obviar porque está traducida, lo voy a decir nomás. O sea, ¿cuáles son las características del servicio? Las mujeres nos llaman por teléfono, ¿no?
She's saying that it's also translated there in English, so if you can really ask you to speak in Spanish how the service works. Is that okay? So we avoid the translation of that part.
Okay, oh yes.
Is that better? Okay. Great. Good.
Bueno, tenemos una línea de teléfono, las mujeres nos llaman, nos encontramos con las mujeres cara a cara, en lugares públicos, como dice ahí, y en lo posible de manera grupal. Juntamos a 3 o 4 mujeres cada vez que nos encontramos con ellas y ahí, bueno, conversamos sobre el devenir de esa decisión, cómo es que llegan a esa decisión, todo lo que quieran conversar las mujeres con nosotras, y trabajamos este folleto que cada una se lleva a su casa acerca de cómo utilizar la medicación. O sea que hasta acá es lo que acabo de decir, vinculado a los encuentros. Y luego les proponemos a las mujeres que nos avisen por mensaje de texto que empiezan con el proceso del aborto. Ese aviso nos lo pasan a la compañera que se encontró con ellas, ¿no? Y les hacemos el seguimiento activo, por eso dice guardia activa de seguimiento. Quiere decir que vamos juntas controlando todo lo que tiene que ver con síntomas.
Do you want to add anything, Michelle?
Via text message or through phone, and this is just to emphasize that we are there with them and we're supporting them throughout this process, and we have active people on duty sending by the phone.
Bueno, lo otro que hacemos, el otro momento, es el control médico post-aborto en lugares amigables. Llamamos amigables al sistema de salud, digamos, a profesionales del sistema de salud que atiendan a las mujeres tratando de no culpabilizarlas, desestigmatizando la práctica, como decía acá la compañera. Y producimos una sistematización con los datos de las mujeres que obtenemos en la primera entrevista. Este año tenemos la primera sistematización de socorristas en red que, digamos, refiere a los datos de 2014. Eso no sé si te lo puse, sí. Que acompañamos en el año 2014 a 1.600 mujeres y que tenemos los datos de 1.116 sistematizadas.
So we've gathered evidence or statistics about who are the women who work with the help and support process, and we generated information on each location. This year, for the first time, with the entire network, the information we presented, they presented this information in a conference this past weekend, and in 2004, they were able to finalize the statistics and generate that they assisted approximately 1,600 women, and then about 1,116. Yeah, 1,116. And then with that, it was just to produce the knowledge in doing a feminist abortion aid, and we have brought out abortion and the science and the clandestinity with those statistics.
Dos, tres cosas que no están ahí y voy a decir ahora sí. Que pensamos que estamos produciendo saberes entre feministas y con las mujeres. La otra cosa es que pensamos que estamos desarrollando una pedagogía feminista, que es una pedagogía vinculada a los itinerarios corporales de las mujeres que abortan. Y la tercera cosa es que consideramos que en parte estamos colaborando para combatir el negocio del aborto clandestino.
So, try my best.
Muchas gracias.
Okay, so I'll try my best with this one. So the first one is really to sort of bring together this spread knowledge amongst feminists and with the women. And then the second one, I might
To develop a feminist pedagogy.
Yeah, to develop
the service that they provide.
Thank you. And then the last one was to collaborate in order to combat the clandestine abortions.
Yeah, the business of clandestine abortion. So those are what they think they are doing with this practice. Por ahí no Everything that every service that they provide is like for free. There's like no charge.
Bueno, para ir como cerrando, si querés buscar las notas de la última parte, que pensamos que mientras hacemos los socorrismos, aprendemos de y con las mujeres de la experiencia de abortar con medicamentos y de los derroteros de sus abortos. Acompañamos el devenir de esos abortos convencidas que en la decisión política, en la práctica política feminista de estar ahí, estamos produciendo a la vez otros feminismos encarnados, corporizados, situados, libertarios, apoderados y sororos.
And I need help with the last one. Just
Yeah.
the last few words. So while we provide assistance, we learn about and with the women who abort via medication and about their abortions. We accompany the process of these abortions, convinced that in the decision to be there, we are birthing other feminisms, incarnated,
Embodied, empowered,
situated, liberalized, and I'm not sure about the last word that she mentioned.
like in sisterhood or sorority, with other women.
Y también pensamos que los socorros nos sirven para seguir argumentando sobre por qué el aborto tiene que ser legal en Argentina y en América Latina y el Caribe. Con los socorros producimos nuevos argumentos. Eso es lo que estamos suponiendo, o nosotras lo sentimos así, y son argumentos que también producimos para la campaña nacional por el derecho al aborto legal, seguro y gratuito que hay en Argentina desde hace 10 años.
The transits from and with the corporality of these women who abort become permitted in order to reflect, for us to reflect and continue producing renovated arguments to demand the right to abort, rooted around the national campaign for safe, free, and legal abortion that has been prevalent in Argentina for the past 10 years.
Y por esto de los nuevos argumentos, ¿no? Queremos, por ejemplo, poner en discusión la consigna que tiene la propia campaña nacional, que es educación sexual para decidir, anticonceptivos para no abortar, aborto legal para no morir. ¿Por qué decimos esto? Porque nosotras reivindicamos el aborto como una práctica de libertad sobre nuestros cuerpos. El aborto no es el mal menor, y no solamente el aborto debe ser legal para no morir. El aborto es para nosotras una experiencia vital que transcurre en la vida y en los cuerpos de las mujeres, y abortar es también para nosotras dar vida. Por eso reivindicamos el aborto legal para decidir, contribuyendo así a desestigmatizar la práctica, como planteaba recién la compañera.
With the feminist aid practices and those who abort, we are thinking and rethinking ourselves. For example, we're outlining a debate that allows us to reconsider the national campaign in Argentina, the sex education to decide, contraceptives to not abort, and legal abortion to not die. We reclaim the right to abort as an action of liberty, not as a lesser evil. The result is a vital experience that takes place in the lives and bodies of women. To abort is also to give life, legal abortion to decide, and as the partner sitting next to her had mentioned, also to destigmatize the abortion process.
Y esta es una imagen de la cuarta reunión donde participamos el fin de semana non santo, como decimos nosotras, 105 activistas de todo el país en la reunión de 3 días de la red. Se fin.
So right up here is just a picture of the conference that they had last week, and it's not holy.
So it was during the Holy Week of Easter, and what she mentioned is like it's like a non-holy week.
And there's about 105.
105 members of the network. So here we have Rosalia Cruz. She is the coordinator of the Center Las Libres, a feminist organization that promotes, defends, and advocates for women's rights in Guanajuato, Mexico. Mexico. And she accompanies women that decide to have an abortion.
Gracias. Si quieres, creo que podemos traducir por lámina, es como, no es tanta información para que igual, aunque es muy fácil, creo que viendo la lámina. Bueno,
Entonces traducimos por cada diapositiva.
sí, la termino de decir y
Okay.
la parte de slide.
Yes.
Okay. Puedes ponerla.
¿Cómo yo?
Sí. Okay. Okay. Un poco del contexto. En México, el aborto es legal hasta las 12 semanas, únicamente en la Ciudad de México. En los demás estados, solamente en caso de violación, en todos en general, teóricamente, porque no se garantiza el acceso, y en otros estados hay algunas otras causales, Yucatán el más avanzado y Guanajuato el más restrictivo.
So just to provide some context, in Mexico, it's legal up to 12 weeks, legal until 12th week in Mexico City, and in other cases, in other states, it's only rape, and then the most advanced is in Yucatán, and then the most restricted is in Guanajuato.
Okay. En Guanajuato, lo que hacemos es acompañamiento integral a mujeres que deciden interrumpir un embarazo, la formación de redes de acompañamiento en otros estados, documentación, defensa y litigio de casos de mujeres criminalizadas, o sea, que tienen un proceso legal, y luchar por la descriminalización, es decir, eliminar el delito de los códigos penales.
So, for the first point, it's having accompanying the women who decide to abort, and then forming networks of a group in other states, and then documentation, defense, and legal cases for women who have been criminalized, and then the last point would be
Advocacy towards, yeah, to advocate for decriminalization too, for the legal reform in all the states.
Para las libres, el acompañamiento es ponerle a las mujeres todos los recursos, todos los humanos y materiales que necesitan para interrumpir un embarazo, para que tengan la seguridad de que no se van a morir, de que no van a ir a la cárcel y sobre todo de que están ejerciendo un derecho humano que para ellas es su opción de vida.
So for us as leaders, it is about putting the tools, the humane tools and the materials so that women can to access a safe abortion and have the physical company of other people there, helping them out throughout the process, emotionally and politically, in their decision, so that they have a moment of certainty that they will not die, that they will not go to jail, and that their health will not be at risk. And moreover, that she is exercising her human right and has the option to live.
Los objetivos del acompañamiento es descriminalización social del aborto a través del apoyo social, mediante el acceso de cada mujer. Es lo que decían ya, ¿no? Si las mujeres tienen derecho a acceder a un aborto, ellas lo viven como si yo tengo derecho, las demás tienen derecho. Reducción del estigma asociado al aborto, confrontación directa a las leyes restrictivas que existen, construcción de mujeres como seres políticos capaces de decidir sobre un aborto médico de manera práctica y eficaz y libre de culpa, pasar de un delito a un derecho. Construcción del derecho a decidir y la autonomía del cuerpo de las mujeres.
So for the first point is creating social support so that they criminalize abortion in the social context. And then reduce the stigma associated with abortion, confronting the laws that are, confronting directly the laws that are restrictive, and then also creating women as beings, as political beings capable of making their own choice to abort in a manner that is efficient and free without any blame, and to transcend beyond a crime into a right. And for the last point, so construction, so create the right to decide and the bodily autonomy for women as well.
Las redes de acompañamiento son mujeres que han experimentado un aborto con medicamentos y que acompañan a otras mujeres, las familiares, amigas, amigos, profesoras, profesores y muchas otras personas que acompañan a estas mujeres, y la multiplicación de las redes en otras ciudades y en otros estados, no solamente en Guanajuato.
So just looking at the network of support, it's women who have gone through an abortion via medicine, and that will accompany other women, and then family, friends, professors, and are the ones that are supporting, and then multiplying the networks in other cities and states.
En el tema de la documentación, defensa y litigio de casos de mujeres, entre 2008 y 2010 se hizo la investigación y documentación de los casos de 9 mujeres que estaban encarceladas en el estado de Guanajuato. Se trabajó en sus procesos legales, que estaban sentenciadas de entre 25 a 35 años de prisión por el delito de homicidio en razón de parentesco. En septiembre de 2010 fue la liberación de estas mujeres, salieron de la cárcel, y después vino la defensa de 2 mujeres más criminalizadas en el estado de Veracruz, y de esa fecha ahora se actúa legalmente en el momento de la denuncia contra mujeres en los hospitales.
So for the first part, in 2008, from 2009 to 2010 investigation, and there was a documented case of 9 women who were imprisoned in the state of Guanajuato. The legal work of these 9 women, they were sentenced anywhere from 25 to 35 years in prison for under homicide, and
I think it means like this homicide like that is like more serious because of the relationship.
and then
I don't know
so-
the exact legal, like criminal term,
Yeah.
but it's like a more serious crime because it's like supposed to be like a child. But
and then in September 2010, the 9 women were liberated, and then there was a defense for 2 of the women who were criminalized in the state of Veracruz, and the actual announcement of the women in the hospitals.
I think they're taking legal action now at the moment of when the hospitals like make the police report and denounce this woman. That's what
Solo una cosa, esas 9 mujeres, lo que a ellas les pasó fue que tuvieron un aborto y sus investigaciones iniciaron por el delito de aborto y en un momento cambió el proceso a homicidio. O sea, a ellas sí les sucedió un aborto, incluso abortos espontáneos. Y las denunciaron y los procesos fueron por homicidio, por eso la sentencia.
So in the case of these 9 women, you know, they first were prosecuted for abortion, but then during the legal process, like the definition changed into homicide, but like
kin, right?
Yes.
Homicide by kin.
yes,
Family
yes.
member.
And some of them even like were cases of just like spontaneous abortion, just miscarriages, that then were classified as a homicide. So very similar to what we see in El Salvador, I think.
And in Indiana.
In Indiana, yes.
Yes, yeah, we have that case there.
Este es un video que contiene los testimonios de mujeres que han accedido a un aborto con medicamentos y de mujeres y hombres que han acompañado a otras mujeres a la decisión. Si quieren que lo pongamos en
Mira,
Sí, dura 4.
So this is just a 4-minute video of women, with testimonios of women that have had access to an abortion through their network, and then of people that were with this women and accompanying the women.
¿Le puedes poner?
Sí.
Full screen, ajá.
Es toda una construcción ideológica que no se lo podemos quitar a la persona como orar y poner otra cosa. Y entonces yo les hablo, hay otro tipo de creencias, no más que no las conoces. Hay otro tipo de creencias, no más que no las atrevido a vivirlas. O sea, hay una falsa moral porque no es cierto allá afuera que todo el mundo se haga responsable de las cosas que hace. Y no es cierto que las parejas sean felices teniendo un hijo, no. No es cierto, o sea, porque la iglesia tengan el hijo y ya cuando vean al niño, el amor les
No es cierto, o sea, no es cierto.
Creo que ninguna persona sabe que existen abortos seguros con medicamento, creo que ninguna persona sabe que puede haber procedimientos seguros, o sea, todo el mundo se imagina la clínica clandestina, se imagina...
Sí tenía así como que dudas eso de usar el medicamento así como que me da cosa, pero bueno, yo lo que quería hacer era abortar, no quería tenerlo.
Bueno, todo el momento ellas estuvieron ahí, entonces era como, está pasando esto, por un mensaje, y ahora esto, y ahora esto.
Pues vine, platiqué con ella y me dijo, es tu decisión, me explicó cuáles eran mis opciones y pues lo dejó en mis manos, como ellas trabajan.
Y pues lo que a mí me mantenía tranquila era que me decía que ellas me iban a acompañar desde el principio hasta el final y nunca, o sea, no iban a dejar las cosas así a medias. Yo creo por eso era que siempre tuve como la seguridad y nunca estuve como asustada.
Las mujeres no utilizan el aborto como un método de planificación familiar y no es para eso, ¿no? 2, ninguna mujer en el mundo se embaraza para abortar, ninguna, ¿no? O sea, no es placentero abortar como para que haya filas y filas de mujeres para que el día que se despenalice todas vamos a ir alegremente a abortar. No es así.
El conservadurismo, la ultraderecha, que hicieron un trabajo que me parece espectacular para poder dañar tanto, ¿no? Un proceso que tendría que ser natural en la mujer desde la toma de la decisión hasta terminado el aborto.
Porque bueno, ¿cómo se nos presenta lo que es un aborto? ¿Cómo se nos presenta la población? ¿Cómo se habla, no? ¿De qué se habla? Pero no se le da la voz a las mujeres, pues sí, no se les da la voz a nosotros.
El simple hecho de que tú puedas estar con otra mujer hablando del tema, ya es vergüenza, ¿no? Hacerlo en un café, que es así casi un escándalo. Estás mal, no, es escandaloso.
No me imagino ahí hacerlo sin que de todos modos lo hubiera hecho, ¿no? Pero sí hubiera sido, yo digo que más complicado cuestión de salud.
Ver cómo las mujeres dicen claro que acompañan esta insistencia que les hacemos de si tú, y que era algo que tú nos decías, ¿no? O sea, por eso son las de acompañamiento, porque si tú accediste a este derecho, cualquier otra mujer puede hacerlo.
Me encanta que siempre salga alguien y pregunte, ¿verdad que las libres acompañan a las mujeres para el acceso a un aborto? Y yo, ¿sí? Y siempre sale un maestro, no sé por qué, y pregunta, pero las acompañan al DF que es legal. Y yo, no, aquí. No, pero ¿cómo? Solo a las víctimas de violación. No, a todas las mujeres que así lo decidan. No, pero ¿cómo? Y pues ya aprovecho para decirle, mira, hay 4 pastillas que se ponen vía vaginal o bucal o sublingual cada 4 horas y entonces estos son los efectos y lo puedes hacer sin ningún problema en tu casa y si quieren, nosotros las podemos acompañar.
Ya solo faltan como 2. Y ya. Este es un trabajo fotográfico que reúne los testimonios de las mujeres que han accedido a un aborto y de las acompañantes. Y bueno, está en una página por si después lo quieren checar.
So the slide here just shows a photography project that actually holds the testimonies of the women who have aborted and the people who have come in throughout the process.
Y este es un largometraje que muestra la historia de las mujeres que estuvieron en la cárcel criminalizadas por homicidio y la lucha que las libres hicimos para liberarla, y muestra un panorama global de los derechos de las mujeres en México, Argentina y Estados Unidos.
It's a documentary.
Okay, so this is a documentary that demonstrates the histories of the women who were incarcerated and the struggle and fight that we did in order to defend and get them out of that situation. And it also shows the global situation of the rights of women in Mexico, the United States, and Argentina.
Okay, thank you so much. I want to also apologize, but I didn't introduce you, the translator, Michelle Bernardina. She's a Monholyoke student, senior. And she's been focusing on reproductive rights. She did an internship in MISU, an organization that headed the campaign to decriminalize abortion in Uruguay, so she's very much present in this topic too. So, sorry, I forgot. So let's open it up for questions.